A changing station is one of the most used spots in the nursery, but it often gets set up like storage instead of a workflow. You might have a beautiful dresser, a cute basket, and all the supplies somewhere nearby. But when a diaper change starts, the real question is different. Can you reach what you need without stepping away? Can you keep the surface clear? Can a tired parent use this setup at 2 in the morning without searching? Today, we will reset the changing area into a simple, safer workflow within reach for you, out of reach for baby, and boring enough to work every time. Start with the one hand rule. During a diaper change, assume one hand stays on or near the baby at all times. That does not mean every change is graceful. It means the station should not force you to turn your back, cross the room, dig through a drawer, or walk to a closet while baby is on the changing surface. Put the essentials inside your easy reach: diapers, wipes, a clothes cream or balm if you use one, a spare outfit, bags or disposal supplies, and hand sanitizer if that is part of your routine. Anything you only use sometimes can live nearby, but not in the active reach zone. This one rule exposes most layout problems quickly. Now build the station in 5 zones: change, clean, treat, dress, and dispose. The change zone is the pad and a wipeable cover. Keep it flat, clear, and easy to clean. The clean zone is diapers and wipes placed where one hand can reach them. The treat zone is diaper cream or balm if you use it, preferably closed and contained so it cannot roll around. The dress zone is one spare outfit, sleep suit, or onesie. Not the whole dresser, just the next useful backup. The dispose zone is your diaper pail, trash, wet bag, or laundry path. When each job has a home, you stop using the tabletop as a junk drawer. The setup starts telling you what to do next. The next reset is removing things that should not live on the changing surface. A common mistake is treating the top like display space: heavy decor, glass items, small loose objects, open containers, cords, warmers with dangling cables, and anything a baby can grab, kick, or knock down should move out of the active zone. This is not about making the room ugly, it is about separating cute from useful. Styling can happen on a wall shelf, in a closed basket, or on the other side of the room. The active changing surface should be boring: pad, cover, maybe a contained supply basket nearby, and enough empty space to move safely. The best changing station is easy to reset when you are tired. Try a daily basket instead of turning the table into bulk storage. The daily basket holds roughly the next day of supplies. A small stack of diapers, wipes, cream if you use it, a spare outfit, and disposal bags if needed. Bulk diapers, extra wipes, and backup products can live in a lower drawer, closet, or storage bin. The point is visual feedback. When the basket looks low, you restock it. You do not need to remember a mental inventory while holding a baby. The smaller station stays calmer, and the backup supplies stay out of the way until you actually need them. Now make the messy version predictable. A washable or wipeable liner gives you a first layer to remove. A small laundry bin or wet bag should be close enough that dirty clothes do not end up on the floor. The diaper pail or trash path should be obvious, ideally reachable without stepping away from the station. If you handle nighttime changes, add the lowest practical light that lets you see clearly and safely. This is not about perfect ambience, it is about reducing fumbling. A good change in setup works on a calm afternoon, but it also works when there is a blowout, a tired parent, and a room that needs to reset fast. One safety note before you copy any setup: never leave a baby unattended on a changing surface, even briefly. Follow the changing pad and furniture instructions. Use the provided restraints where applicable, and still keep a hand near baby. Restraints do not replace supervision. Keep cords, small loose items, open containers, heavy decor, and glass away from baby reach. If you use creams, medicines, or skin products, follow the label and your clinician's advice. Nursery organisation can make care feel calmer, but it should never create a false sense that you can step away. Here is the simple stand-in test. Stand where you normally change a diaper and ask, can I complete a full change without stepping away? Can I reach the clean diaper, wipes, cream if needed, spare clothing, laundry, and disposal path while staying close to baby? Is the active surface clear, or is it acting like a shelf? If the answer is not quite, do not rebuild the nursery. Move the next 3 things you reach for into the right zone, and move the next 3 hazards out. You do not need a perfect nursery. You need a repeatable setup that helps a tired parent move calmly through a task they will do thousands of times.